Last week, Governor Polis discussed the state's plans to distribute a vaccine once it's been approved. Joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, the priority will be for healthcare and frontline workers to be vaccinated first. So that could mean it would take a while before a young, healthy person could get the vaccine. What do you think of this distribution plan?
Well, I think it's a good framework for what needs to be done in terms of getting the vaccine to the people who need it the most. It will take a while for everyone to get vaccinated. The state has been tasked with the duty of coming up with a plan, just as each other state in the country has. And our state is pretty much in line with what many other states are doing. They have prioritized who should get the vaccine first. And the reason for needing priority is the fact that we're not going to have vaccine for everybody starting on day one. The day a vaccine is available, there simply is not going to be enough to give it to everyone who really is going to wind up requiring it. So what the state has done is it has broken the system into a tiered system, basically 3 major tiers of priority in terms of who should get the vaccine first. And within those tiers, there are subgroups. And those subgroups actually total around 16. And so you start out with people who are healthcare workers, people who are directly involved with the care of people with COVID. They are deemed to be at the highest risk. And then it will be other healthcare providers and pharmacists. It will then be first responders, then nursing home residents and assisted care facility residents, and then it will move down the line to essential workers and so on and so forth. And so actually when you get to the bottom of the list, it is those who are age 65 and older and those with pre-existing health conditions. And then last on the list is pretty much everybody else, people who are otherwise deemed to be healthy. And so it's going to be a while before we are able to get enough vaccine to get that group vaccinated. And I think really realistically, you're looking at easily about a year before that's going to be possible. There are a couple of issues that are going on. First off, we don't know what vaccine we're going to be using. There are going to be issues in terms of getting it to where it needs to be distributed and how it's going to be administered, because is it going to be a vaccine that requires 1 dose, or is it a vaccine that's going to require 2 doses? We don't know how well it's going to work. We don't know how long it's going to take effect and then be effective for in terms of its duration. There is also an issue of not being able to just simply go to the pharmacy or doctor's office and get a vaccine just like you would for any other type of disease. It's not like simply going and getting a flu shot. Most of the vaccines that will be available are going to require special handling. They need to be kept at least 80 degrees below zero, which means they require dry ice in order to keep the vaccine itself in a viable state. And right now we have a shortage of dry ice in the country. So there are a lot of steps that are involved in this. And I think the bottom line is that even though you hear that a vaccine is just around the corner and it's going to be distributed, we are going to be doing things like masking and social distancing and so forth for quite some time.
Yeah, a lot of questions still surrounding how that's all going to work. Let's talk about those new restrictions that Denver has put in place following the rise in COVID-19 cases, stricter mask mandate, stricter limits on gatherings. Do you think these restrictions are enough to get those case numbers down?
Well, I think it's a start. I think one of the biggest issues is the fact that unless you wind up doing a total shutdown, you really do need to nudge people and get them back into a place to where they feel good and feel like they are able to take the precautions that they need. We all have noted that there are instances of the virus being driven by a little bit looser behavior, so to speak. I think there are basically 3 groups that we look at. We look at, the majority of us. We have coronavirus fatigue. We're sick of being afraid of getting sick. And so as a result, we see case counts had been going down. We wind up getting a little bit more lax in how we are in terms of taking precautions, in terms of getting together with other people. And that's a big problem because we wind up increasing the case numbers that way. Second group is younger people. You look at younger people, they think that they are young and invincible, but yet that group tends to wind up getting sick and can still get terrifically sick. And then there's the fact that this younger group can wind up spreading it to older, more vulnerable populations within the community. Then you look at the third group, and the third group basically consists of people who feel that their personal liberties are more important than the personal liberties of everybody else in the community or in the country for that matter. I think everyone needs to sort of get on the train of recognizing that if we do want to open up the economy again, if we do want to get businesses going, if we want restaurants to stay open, if we want people to be able to return to their jobs and stay at their jobs, if we want schools to reopen, if we want to spend Thanksgiving together as families, now is the time that we need to take action because we truly are at a fork in the road. We have a decision to make whether or not we can slow things down or whether we're going to just let them run away. And it actually has potential to be a catastrophic wave, this third wave that we are right on the cusp of when it comes to an explosion of coronavirus cases.
Thanks so much for all that information. Yeah, a lot of people still wondering about those mask mandates and what this means. So certainly follow those regulations for now. Herd immunity, it's gaining some traction again with the White House saying it supports the idea. What exactly is herd immunity and why are major medical organizations blasting that theory?
Herd immunity basically means that enough people in the population become immune to a disease to a point or to a level to where others, more vulnerable people who are not immune, nonetheless wind up being protected because everybody else is immune to that particular disease. And usually you achieve herd immunity by vaccination, big vaccine programs. For example, measles is a disease that has herd immunity because of the fact that most people have been immunized against measles. But COVID is a totally different sort of situation. And there are people who are wanting to shortcut the situation right now where we are looking to try to open up the economy and do things, and we are waiting on this vaccine. So it's like, well, let's just kind of skip through things. Let's just open everything up. Younger, more healthy people can handle getting sick, so let's get rid of masks. Let's get rid of social distancing. Let's let people go to work. The people who are going to get sick, well, they're going to wind up doing better. And if you are someone who has a pre-existing condition or you're older than age 65, well, you need to just hunker down for whatever the duration is going to be for a natural herd immunity to take effect as we wait for a vaccine. The problem with this is that it just doesn't work. Sweden tried it, and it really wound up being a disaster for Sweden. They opened everything up. They wound up letting people go to restaurants. They wound up people doing basically anything they wanted. And what wound up happening with Sweden is the fact that they now have the highest per capita rate of COVID in that area of the world. They are close to the United States in terms of the number of cases. People have had healthcare rationed. Hospitals are overflowing. Older people or people who are terrifically sick are not being able to get the care they need for this. And as a result, they're backtracking now in terms of really having to reenact restrictions once again. What does something like this mean for America? Well, if we wind up going down the road of let's hurry up and push this theory of let's just let people get sick, get rid of the restrictions, we're looking at anywhere from 2 to 4 million deaths very quickly from having this. And that just simply is a reckless sort of approach to this. It's hard being patient, it really is. But I think it is the one thing we have going in our favor is the fact that we are a strong country, we are a resilient country. And I think if we're able to just allow for the vaccine to be distributed, continue to practice good social behavior, I think that we can avoid having to even listen to the idea of herd immunity where it's the survival of the fittest.
Very interesting. Dr. Dave, thank you so much, as always, for joining us. We'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com. We'll be right back.